Time now for Morning Rounds, our look at the medical news of the week. First up, we're in the warmer months, a time when ticks are at their most active. And that, of course, means more cases of Lyme disease. It is the most commonly reported vector-borne illness in the country, meaning illnesses transmitted from animals or insects to humans.
According to the Centers for Disease Control, there are around 30,000 cases reported each year, although the actual number is likely to be much higher. In 2015, 95% of these cases were reported in 14 states, a majority in the Northeast and New England regions. A new study out this week in the Journal of Medical Entomology examined a new type of bacteria that can cause Lyme disease. Here now to talk about this, CBS News chief medical correspondent Dr. Jon LaPook and CBS News contributor Dr. Narula. So, Jon, give us some idea. What did the study look at and what were the main points that they found?
So here's what they were trying to figure out. How long does this new species have to be does the tick carrying this new species have to be attached to you in order to transmit it? The reason why that's important is that the typical species, the tick has to be attached 36 to 48 hours before it gets transmitted. So it's very important to see, is it the same thing for this new species? And they did studies in mice and they found that, yes, thankfully, it has to be typically more than 48 hours for there to be a significant chance of transmission. It can happen rarely before then. Why is that important? Well, when my patients call me, which they did this past weekend, and say they have a tick on me, one of the first questions I ask is, how long was it attached to you? If it was attached for 36 to 48 hours or less than 36 hours, then the odds of them getting Lyme disease from it are very low. And so if it's more than that, then there are various strategies with antibiotics and watching people for symptoms that can be used to try to figure out whether you should treat or not treat.
So, Tara, this obviously now is the time, and more people are spending more and more time outside. So what kind of tips are there for folks who are now hitting the hiking trails?
Right, and I was just thinking about this weekend in Connecticut when I was walking with my 5-year-old outside. So you clearly want to be outdoors, but you can take measures and be vigilant, particularly in these warmer months. So you want to stay in the center of trails and really avoid those kind of high, tall, grassy, bushy, wooded areas. You want to make sure when you come indoors, you do a full body tick check. You want to bathe or shower typically within 2 hours of coming in. Check your kids, check your pets, check your gear. Make sure to use repellent, at least 20% DEET. You can buy permethrin-treated clothing or spray that on your clothing and gear. And then one other tip that Jon and I were talking about is to tumble dry your clothes when you come in on a high setting for about 10 minutes, and that should kill any ticks.
And the other thing is that the ticks are not shy. Okay, we have to get nitty-gritty. You have to look everywhere, including where the moon don't shine.
Yes.
Because they like to crawl up, and enough said, but you really have to look at every millimeter of your body.
No, really, and no matter how much prevention there is, some are going to get through, and there's so many different symptoms. Give us some idea of the major ones that people can look for.
Well, one of the things is that, you get this classic rash, the rash of Lyme. It can be anywhere from 3 to 30 days. It's typically within a week or two. Not everybody has that rash. You can have aches and pains, a flu-like illness, fever, headache. So if somebody
they seem so normal, though.
They seem, and there are a lot of times that people have these viruses and it has nothing to do with Lyme. But I think a high level of suspicion is very important. And then there are some other symptoms, like you can have neurological symptoms, especially later. You can have a Bell's palsy, where you have drooping of one side of the face. You can have late symptoms, and we've heard about chronic Lyme and all of that. So I think the bottom line here is you want to have a very high index of suspicion, especially if you're in an area where you know that there's Lyme.
Right. Our next topic is equipping yourself to hear better. A newly published research letter in the Journal of American Medical Association compared personal sound amplification products with traditional hearing aids.
Also known as PSAPs, they are less expensive than hearing aids and can be purchased over the counter. However, the devices are not specifically labeled for hearing loss treatment like conventional hearing aids. Testing was done involving a group of 42 adults with an average age of 71. So, Tara, in comparing these sort of new devices with traditional hearing aids, what did the research find?
Well, the issue is that we really need more low-cost, accessible options for people. And that's what these PSAPs are offering right now. And so when they compared them, they found that unaided speech understanding accuracy was about 76%. With hearing aids, that improved to about 88%. With the PSAPs that they looked at, it improved to about 80%. So there was some improvement, but not to the degree that it improved with hearing hearing aids. In fact, one of the 5 PSAPs they tested had worse speech accuracy understanding. So again, this was a small group of people. It was only 5 products, the PSAPs that they tested. So we need a lot more research into this and certainly more options for people.
And it's actually not just the medical community that's looking at it. There's bipartisan legislation surrounding hearing aids right now.
Yeah, and they're looking at it right now. And the reason why that's so important is almost 50 million Americans have some degree of hearing loss.
This is like getting behind apple pie, isn't it?
Yeah, it's really easy. Less than 20% of people with these hearing problems are actually having any kind of hearing device, something to help them hear. And the reason is it's expensive. So for Medicare, for example, it's covered for you to go to an audiologist, an expert, and say, okay, you need a hearing aid. But the hearing aid itself, which could be more than $2,000, that's not covered.
Makes no
so
sense.
Something needs to be done.
Yeah. Well, let's finally go to our last topic, medical solutions from the sea. A study published by the American Society of Microbiology looked at the research for tuberculosis treatments in ocean life.
A team of researchers at the University of Central Florida screened more than 4,000 chemical extracts from ocean creatures like sponges to see if they could find any that might be effective against the disease. In fact, they turned up 26 compounds that were effective against replicating bacteria, but they note they have a lot more work to do studying them in detail.
So what does all of this mean?
Well, so many of our medications come from plants. Yet another reason to peacefully coexist with nature.
Yes.
Not destroy it.
Like we needed other reasons.
Yet another reason.
Doctors Jon LaPook and Narula, thank you.